Hello, and thank you for joining me for the next video in the series on cardiovascular kidney-metabolic syndrome, or CKM. I'm Viet Le, an Associate Professor of Research and a Preventive Cardiology PA at Intermountain Health in Salt Lake City. Today we're going to discuss Maria, a 46-year-old woman who presents for annual well visit after completing pre-visit labs. She works as a home health aide, and because of her erratic schedule, with long night shifts and limited access to affordable fresh groceries in her neighborhood, she often relies on fast food for meals. She currently has no medical diagnoses and takes no medications. Maria is 5'4" tall and weighs 185 pounds, which gives her a BMI of 31.8. Her waist circumference is 37 inches. Using standard BMI categories for adults, obesity is defined as a BMI of 30 or higher, so Maria would be classified as having Class 1 obesity. BMI is a useful screening tool, but it does not tell the whole story. Waist circumference helps us assess central adiposity, and in women, a waist circumference greater than 35 inches, or approximately 88 centimeters, is associated with higher risk. Maria's waist circumference is 37 inches. Maria's labs will tell us more regarding obesity-related complications. Her blood pressure is 124/78, and her A1C is 5.5. Her lipid panel shows her total cholesterol is 192 and HDL cholesterol is 52. Her eGFR is 96 and her urine albumin to creatinine ratio is 12. These results are within normal limits, but several are trending toward the upper end of normal and reinforce the importance of continued risk monitoring. In practice, we should think of beyond obesity classification alone and also identify where patients fall within CKM syndrome staging. Maria has Class 1 obesity, but no cardiometabolic comorbidities, so based on the 2026 AHA guideline, she is considered to have CKM Stage 1. Remember, obesity stage documents the degree of excess weight by category, while CKM stage places that finding into a broader cardiometabolic and renal risk framework. When we document both, we communicate not only that the patient has Class 1 obesity, but also that she has already entered the CKM continuum and warrants risk-based screening, prevention, and follow-up. To refine CKM staging, I would also use the Prevent CVD calculator. Based on Maria's clinical characteristics, her 10-year risk for cardiovascular disease is 1.7%, and her 30-year risk is 12%. From there, the next step is to ask permission before moving into a conversation about weight and treatment. For example, I might say, "Maria, would it be okay if we spend a few minutes talking about how your weight may be affecting your health and what options we have to reduce future CKM risk?" That simple step helps keep the discussion respectful, patient-centered, and collaborative. In my experience, patients are far more likely to engage when they feel supported rather than judged. If Maria agrees, I would explain that lifestyle treatment remains foundational and provide coaching on nutrition and physical activity, emphasizing that the goal is to improve health, function, and long-term risk, not simply the number on the scale. At the same time, it's important to recognize that obesity is a chronic, often progressive, relapsing disease driven by complex neurobiology, genetics, environment, and physiology. Evidence-based treatment with obesity medications should be considered as part of a comprehensive, long-term, patient-centered care. It's important to note that we cannot force a patient to be ready to talk about their weight, but it is an opportunity to prevent them from escalating their CKM stage and their risk for cardiovascular disease. So, as PAs, we shouldn't avoid these conversations simply because they can feel uncomfortable. This is our chance for early intervention. Now, let's imagine that Maria's obesity was not adequately treated. Perhaps she was uncomfortable discussing it at this time, or perhaps she chose to work on lifestyle modification but was not ready to consider pharmacotherapy and experienced only limited weight reduction. This isn't uncommon with our patients. In the next video, I'll come back to Maria, but 2 years later, and we'll discuss how her CKM syndrome and associated risks have progressed. See you there.